I want to get back to Maageketla Mohlabe, SABC news reporter who's live for us in Johannesburg. Maageketla is tracking how some health care workers are being vaccinated by the Sisonke program. Let's get back to him. Maageketla, very good morning to you once again. What's the latest where you are?
Yeah, a very good morning to you, Blaine. So far, things are running smoothly here at the Mill Park Hospital. And as you can see, I'm just going to step out of this shot as my colleague, Gabi Njogweni, will show you the pictures over that screen there. Many of the health workers, of course, trying to make their way to where we are, this side, because that's where they have to be screened first before they could then come through some of this desk. And I'm going to ask my colleague to walk a bit there, to just zoom in there. This is where, after they got screened there, they will actually come through and then show the proof that they are health care workers. They have to produce their identity documents. They have to produce any paperwork that is necessary for this particular vaccination process to actually take place on them. But as you can see, that's one of the health workers trying to also show some of the reference numbers that they have been given to make sure that there's no cheating. As you are aware, Blaine, there have been some reports that there are some people who have tried to cheat the system and have successfully gotten vaccinated ahead of some of the health workers that need to be vaccinated on the last day of the Sisonke J&J COVID-19 study. And some of these obviously are seated on these chairs here. There is social distancing that has to be observed, and over and above that, after being vaccinated, they then get to take selfies beyond that particular line there. But we're going to speak to some of them. If you can just talk to us, my sister. They want to take us through where they actually got in to take selfies, and that's what they do. After they get vaccinated, they come to this particular area here. It's a selfie section, according to some of the officials here. As you can see, some people are taking selfies just to say, well, we are done. And up there is written, I got my COVID-19 vaccine. And this is where the last process is. But before here, Blaine, there is a section on my right-hand side where we are not going to necessarily show you. We have been requested to actually observe that, to say that people who are actually sitting in that section for about 15 minutes of observation after getting that jab, they need to be given that privacy, and we are going to respect that. And after doing that 15 minutes observation, then they come here and then they take the selfies. As you can see, one of them. Now let's speak to one of them here. She just got in a selfie as well. He got vaccinated. My sister, thanks so much for your time. Talk to us. How has the process been for you?
Yeah, the process was fine. We just followed the queue, and then according to the way they want us to do it, we did vaccinate, and it was fine. I was so scared, but after I done it, it was like, right, it was fine. Yeah, a little bit dizziness, but actually I'm okay now, so I can go home.
Little bit of dizziness, and you are saying that you were a bit scared. Why were you scared?
Because of people, the way they like talking about this vaccine, so I was like scared even myself. But now I did done it, but that's nothing more or less I can feel so far.
Those conspiracy theories about COVID-19, I mean the vaccine rather, obviously instilling fear in you, but here you are, you were in the long queues out there, I'm sure. Other people were turned back yesterday. Are you among those who were turned back?
No, I was in the one, but they are. But today I just came, it was long queue, but it was faster, and then we finished at least as early as. But other people are still on the queue. So I'm lucky I'm done. And then I can go home. I'm happy even like that, I'm happy.
Absolutely. My sister, you are among health workers as well who are here. You just got vaccinated as well. How do you feel?
I'm feeling very dizzy and my arm is painful. But at first, when I got inside, I was very nervous because, when you're surrounded around people, the things that they talk. So I was just anxious, very scared, frightened actually. But now I'm actually better that I got vaccinated. So I'm just hoping for the best.
And you're looking forward to helping people at hospital to make sure that this curve is flattened as well?
Yes, I am. I'm going to tell my friends that I actually got vaccinated and show off with my card.
Yeah, absolutely. Thanks so much for your time. And those are some of the health workers, and they continue to take selfies here, Blaine. But of course, bearing in mind that many of them returned here at Mel Park Hospital, because yesterday they were turned back. The hospital ran out of vaccines. Earlier on, we spoke to the vaccination center manager here at Mel Park Hospital, who detailed about that particular issue. And let's just listen in to what he had to say.
Vaccination site is allocated a finite number of vaccines from the central holding areas. We yesterday managed to procure additional vaccines when we saw the numbers that we had. So we did our absolute best to get everyone vaccinated on the day. Unfortunately, we did have to turn some people back. They were placed on a prioritization list for this morning. Many of the people you've seen come past us behind us here in shot are members of that list. We brought them back today to get them done. We obviously do know, as you correctly say, it is the last day of the vaccination. We are pushing as hard as possible, working long hours here to get as many people done, but unfortunately we may need to turn some people away. There just are so many vaccines for us here.
Yeah, and Blaine, there have been issues as well. Other people cheating the system, as I mentioned earlier on, and this has been a huge concern, considering that today is the last day of the Sisonke J&J COVID-19 study, and obviously you can just imagine many of these officials under pressure to make sure that 500,000 mark or target by this study is met by today. He also mentioned about that concern, and perhaps let's just listen in to how they had to deal with that issue.
We do obviously appeal to the morals and the ethics of everyone coming through, and really do explain that taking a vaccine away from a healthcare worker, if you're not a healthcare worker, that comes down to everyone's own justification within themselves. We have multiple screening processes to try and weed out those people. I won't stand here and tell you that there aren't possibly some that have got through, but we do our utmost to ensure that it really is only our precious healthcare workers that are being vaccinated.
Yeah, Blaine, just lastly, we will be monitoring the situation here, but from what I understand is that outside traffic, it's chaotic. People still trying to get this particular center here, and when we got here early in the morning around 7 a.m., we actually saw many vehicles trying to navigate their way to the Mel Park Hospital, and I suppose obviously health workers who were trying to make sure that on this last day they get the jab. But I'm sure you've already mentioned that should some of them miss out on this day today, they will still be part of that phase 2, which is expected on Monday in terms of, or as far as the national vaccination rollout is concerned.
Important point, Maageketla, because I guess the message is no one will be left behind with regards to if they want a vaccine regarding the healthcare workers. By the way, I can bear testament to that traffic jam this morning. I personally got caught in that, so it was a nightmare getting through there. You can get a sense of the urgency in terms of people who want to get vaccinated. What about vaccine hesitancy? It refers to this delay in acceptance or even a refusal to get vaccinated despite it being readily available. And I guess it's a complex issue. It has to deal with complacency. It has to deal with confidence maybe, the speed, the rate at which this vaccine was developed kind of creates certain issues in people's minds, but scientists have assured us that it is safe. What's the sense you're getting on the ground from speaking to healthcare workers? Are they concerned that people, this can be an issue in South Africa when it's rolled out to the public en masse?
Yeah, I mean, definitely, Blaine. I mean, speaking to some off camera, and of course, they were obviously scared to speak on camera for some reason. But they are indicating that, it looks like the country is lagging behind when it comes to this vaccination process. And they are pleased to the government to make sure that no one is left out, as you mentioned in that particular sentence. They are actually pleading to the health department to actually fast track this process. And as you actually heard the two of the health workers who just got vaccinated, they are saying that they were panicking amid all these conspiracy theories about the vaccine. And they are hopeful that this process here, they are frontline workers, of course. This process here will actually assist them with these reports that we are likely to go into or to face the third wave of this particular pandemic. They are actually pleading with government officials to make sure that there is enough availability of the vaccine, and to make sure that once this process starts on Monday, it should run smoothly. We should actually not be seeing what we saw in a couple of days here, where people had to be turned back. And these are health workers who are actually in the front line and who are actually going to be facing patients who are probably infected with COVID-19. And their plea is basically to say that we should avoid what we saw here, because it was so unnecessary. And for them to go back home to actually come back in the early hours of the morning, others saying that they had been here since 5 a.m. and it's sort of taxing for them. And when we got here, in fact, Blaine, we saw some of them even sitting on the floor, sleeping, leaning on the car bonnets at this particular parking lot. And I can tell you that we are on the 7th floor of this parking lot. All throughout, coming up here, we saw long queues. And I can just imagine with that traffic jam-packed out there, obviously, then you can just imagine that even the queues might as well be shooting out of this parking lot here. But we will be observing the developments here at the Mel Park Hospital, and we will be giving you any detail as it comes.
Maageketla Mohlabe, as always, great reporting. Thank you very much indeed. We'll go back to him in a short while for an update.